Dr. Roland, the CDC. There's reports from the Associated Press that the CDC this afternoon is going to ease restrictions on indoor mask wearing for people who are fully vaccinated. I don't know if you guys had heard about this, and also drop it for outdoors basically everywhere. So I don't know, would you be on board with that?
Yeah, so I'm getting the same text you are right now as I'm sitting here, and certainly going to evaluate that. It hasn't come yet, but just like we responded to the outdoor masks a few weeks back, we'll be promptly looking at it and relying on our health department to make the right call, but the CDC is a good endorsement.
So I just on the nightclub issue, how are you going to enforce that nightclubs that want to be 100% open their customers are showing that they're fully vaccinated, or are you basically going to rely on them to do that?
No, I'll let Stefan answer that one, but just like we rely on people to follow the protocols today, there'll be follow-up and inspections, and we're expecting people to follow the protocols. They're going to be very happy to be opened up, by the way, even at the stage of 50%. But Stefan, you want to just answer that?
It's exactly as the governor said. We are in touch with nightclub owners, and we are consulting with these establishment owners on the protocols, but we'll work with them on those that are interested in the flexibility to get to 100% by the showing of a vaccination on the procedures that they think will be practical. And we are retaining professional inspectors for the time being, so they'll be collaborating with owners and working on what they'll be looking for when they do visit and understanding what the protocols ought to be.
So basically showing your card when you show up at a nightclub?
We're working on whether the showing of the card itself is the only method, or a digital image of a card as well. If someone wants to bring a phone, that's a conversation simultaneously with the Department of Health and with the owners on what they think is practical.
Governor, there's a report in the New York Times today that Randy Weingarten of the American Federation of Teachers is planning to say today, there is no doubt schools must be open in person 5 days a week in the fall. Do you agree with that, and are you committed to making that happen in Rhode Island in the fall?
Yeah, I've been on the record for several months saying exactly that. We want the students back into the classrooms in the fall. We'd like to encourage as many of the students in the classrooms between now and the end of the year, as in my comments. So I think it's critical. That's why our kids are our highest priority, and that's why I made teachers and school-related personnel eligible for vaccination early in my time as governor.
5 days a week, full reopen, you're committed to that?
That should be our goal. Should be in not only K through 12, but also our universities.
Director Weldon, we have got an awful lot of independent contractors, 1099 workers here in Rhode Island that are probably wondering how they should report job applications. Can you kind of walk us through what you'd be looking for? Say somebody who's an independent contractor were audited. What would you expect to see from them as a work search requirement?
Sure, thank you. If they're an independent contractor and let's say they were a gig worker, they should be re-engaging with the platform that they worked with before, or look for some other ones. I mean, I'm out in the community every day. I see, whether I'm in a grocery store and I see people that are working for a platform, getting groceries to be home delivered, or I know that there are ride-sharing services on the road, they can re-engage and get back to work now. If they're not able to do that, they can also apply for traditional employment. Engage in business development activities if you own your own business. And as I mentioned, that could be anything that you think will help your business get back up and running and grow, and just document it. We're reasonable people. We want to see that you're doing what we asked you to do, you're following the rules, and that income support is there for you as you're trying to get reconnected with the economy.
So that might include grants or things like that. If you're a nonprofit, you're a one-man band type situation, that would be acceptable?
Absolutely.
My question is for either doctor. What are you hearing from parents of those aged 12 to 15? Are they eager to get their kids vaccinated? Are they more on the fence? What are you hearing?
I will speak to the fact that I've been getting phone calls probably 7 to 10 every day from people asking exactly that question, and I pretty much give them the same message I give them here. I think people do like the reassurance of hearing it from somebody they know that this is a really good idea.
Okay. Director Weldon, with regard to unemployment tax, there have been numerous reports of employers who've had a in the past, a low experience rate, that is, they aren't laying off people, of unemployment tax seeing their rates skyrocket. Given the state's role in shutting down businesses, is it fair to leverage the impact of the unemployment fund on businesses who are just getting back to business?
So I want to separate the two parts of that question, actually. The experience rating that an employer gets, unemployment insurance works like a lot of other taxes work. The more that you use the program, the more your experience is hit, and then you have to pay more in taxes. Experience rate is a separate issue from the tax increase that happened this year. No one's experience rate would have been increased or impacted if they had claims filed that were related to COVID. Any regular lack of work claims that were filed for seasonal employment or anything else, that would still have hit an employer's experience rating like any other year. That's what the executive order did last year. What happened with the taxes generally this year is that even though we were able to push about 20 to 25% total of the claims that we paid in 2020 until now have been funded by the state trust fund. 75% or so were funded by the federal government. So first of all, we haven't had to borrow, which is exceptional. There are over 20 states that have borrowed from the federal government. When you borrow, your taxes go up across the board. We haven't had to do that. But the 20 to 25% of the funds, the claims that we paid, had to come from our state trust fund. They weren't attributed to an individual employer, but they were charged to the fund as a whole. There's a statutory formula that we apply in the fall. We have to look for a reserve ratio, how much money is in that account, and what were the total payrolls over the prior year. And that's what the number that tells you what tax schedule you'll be on in the following year. So this year, our schedules went up 2 schedules, which on average, I think, was about $70 per employee for each employer in the state. The governor has asked us to look into ways to try to deal with that. We know that it's a hit to employers and that they're paying more right now. Over 3 of the previous 5 years, they had seen savings after savings. There were no savings prior to that from 1992 until 2017. Now, unfortunately, because of the use, it did go back up, and we're looking into it.
With regard to inspection, how many inspectors will you employ in determining, for example, if someone's met their 3 job applications per week statutory requirement? And will the House legislation that passed, I guess at the House level yesterday, effectively create only a part-time return to the workforce, making scheduling for employers very difficult?
Okay, the first part, how many people, we call them adjudicators, inspectors, the same thing. The unemployment staff was doubled throughout the pandemic, and when you add in the retirees that we brought back and the third-party vendor that we brought, it's almost 4 times as many people. We will shift resources to have more people. I don't know the exact number yet. It's going to depend on how many claims we have at the time. Right now, we have about 67,000 to 69,000 people a week that are getting paid. We will put an appropriate number of people in to review those claims. We'll use staff from across the agency to help out, working with our union to make sure that we can do that.
The follow-up was under the incentive that was created by your legislation, there's a fear of many that effectively the return to the workforce will be heavily part-time based, which will create chaos for restaurants and retail organizations in scheduling.
I don't think it creates chaos. I think they're facing really challenging times right now without being able to staff their operations, and the governor and I have heard from them. This will allow them to have people work up to maybe 30 hours a week and still stay connected to unemployment. To us, it allows them to fill shifts that are going unfilled right now, and it's going to be part of the solution.
I have 2 brief questions, one for you, one for the governor. As far as the demand for the 12 to 15-year-olds, do you have any early data to see how many people have been going out? I know there was a study that showed, about a third of parents say they would get their kids vaccinated right now.
Yeah, it's still early, but within the first 24 hours, we had about 300 12 to 15-year-olds that we vaccinated. I think, one of the promising things that we've seen is that 16 to 18-year-olds have really stepped up and done their part. We've already vaccinated about 41% of 16 to 18-year-old Rhode Island. So, I think we'll have a couple of opportunities here. One, in the schools, over the next few weeks, and then obviously at all of our locations. And then as we continue to push vaccination opportunities to primary care physicians, specifically pediatricians, I think we will have plenty of opportunities there.
And Governor, now that the briefing will slowly, in a couple of weeks, move to the State House, does that mean the State House will be open to the public?
We'll have our stateroom and our office open, but that decision hasn't been made yet. But we are definitely in process. I think I mentioned in a few interviews that we got a core group of people in our office really discussing the issue about reopening state government. So we would expect to have some definitive strategies there before the end of the month.
Governor, your counterpart in Ohio, Governor DeWine, is offering $1 million lottery prizes each week for people to get vaccinated. Do you have any plans to do anything along those lines or step up the incentives for vaccinations?
Yeah, we don't have $1 million, but I think that we're going to continue to do the work we're doing right now, and we're having success, right? So we're going to just keep on doing that. We'll be reaching out to the Boys and Girls Club shortly, all our networks. I just want to thank the people in the state of Rhode Island for stepping up. I was at Broad Street this morning. A business owner stepped up. We had food there. Food's good. We had nice cupcakes there by one of the business owners donating. And so we're going to engage our business community as creatively as we can. The general public as as creatively as we can. Although, $1 million not a bad thing for a lottery. I'm not sure I'm there yet.
Tom, if I could, circle back on the demand for the vaccine, it does seem like kind of the average daily administration has dropped over the past couple of weeks, and particularly with the first doses. Are you at the point yet of asking for less vaccine, or is the demand lowered? I know you mentioned the 16 to 18-year-olds, but I don't know if the 25 to 29-year-olds was kind of low and stuff like that.
Yeah, we're not at that point yet. I'd say we're definitely, at a point where supply has met demand, and what having some of the additional doses in the state allows for us is some additional flexibility to offer vaccination opportunities. And what I'd ask is, among our partners, we have done clinics where we vaccinated 9, 10 people at a time, and that's fine. That's where we are. That might be the only way you're going to vaccinate 10 people. And we had a great example this week where only 4 people registered for a clinic. The folks that were hosting it weren't sure that they were going to have it, and we sent a nurse out there with 20 doses. We ended up vaccinating 11 people. So that's kind of where we are. It's going to take longer. We're going to constantly make sure that we're a good partner, though, and we're taking the vaccine that we need as we look at where we are nationally.
Follow up. I know that the New York Times, the national ranking, still has Rhode Island 5th, I think, in fully vaccinated percentage and 7th in first doses, but now down in the 30s for percent of doses used. Does that mean more is sitting on the shelf again? What is happening with that unused dosage now, and is that in fact what's happening, that more is sitting around? How long can it sit?
That's what that reflects. We have more vaccine in the state than we've ever had in the past. A big part of that was when we received that large batch of additional vaccine several weeks ago. So it's stored properly. It's good for months. There's no concern about this expiring or going stale. But what we're doing each week, part of shifting away from those large batches of appointments that went out Tuesdays and Fridays, is every single day we're dynamically reallocating it throughout the state at pop-up clinics, working with our partners. So it's just given us a tremendous amount of additional flexibility. And I think the added benefit was when we got those extra doses, we knew that week that it was time to shift to phase 3, and waiting for people to come to us at our large mass vaccination sites was no longer going to work for Rhode Island.
Did I hear you correctly earlier? Did you say that you've already vaccinated 40% of kids in Rhode Island between the ages of 12 and 15?
For 16 to 18-year-olds, it's first dose for 41%. 41% for 16 to 18-year-olds. Yep.
Now, talk about giving back vaccines. I mean, the doctor to your left talked about even younger. Is that going to be a challenge to get enough vaccine to challenge kids as young as 6? If the age drops to 6?
Absolutely. I'm confident at this point that we're not going to find ourselves in a situation where demand outstrips supply. So there have been some additional flexibilities put in place at the national level where, based on demand across the country, there's a federal pool that states can pull from based on their demand. So I'm confident from here forward, we're going to have vaccine for anybody that wants it.
I think for Secretary Pryor, when nightclubs require proof of vaccine, will they still be required to enforce masking indoors?
As of now, yes. We will be evaluating the CDC's recent determination. So we've just learned of that prospective determination while we're on the stage. But as of now, yes, mask wearing will be required.